Well, thank you, first of all, for inviting me. I'm hoping you're hearing me because I've got a really old Dell laptop, so let me know if I'm not close enough. I have not been a nurse for 40 years, so congratulations, Laura, that's brilliant. This is my second career. I actually came to the Valley in '91 to work for Outward Bound, and I came for 5 months, and they haven't kicked me out, so I'm still here, and trained at Wenatchee Valley College in Omak as a nurse. And so that was graduated 15 years ago, and pretty much I worked at the Winthrop Clinic in Brewster. It's been my main hospital with a few stints elsewhere, but realized that rural nursing is where my heart and passion is, and I do see little Three Rivers Hospital as kind of my family hospital. So that's just my little background. And I try and leave, and then I always seem to end up coming back. So I accept that, you know, it is where I'm the most happy. But I think I never intended to be, I never thought I'd be a nurse. It's just something I stumbled into. And when you get hit like something this year, it's definitely not what you know, to be honest, is not what I signed up for. So I think that was the #1 shock when, you know, realized this is a pandemic that's coming. And, you know, I'm sure we all went through our own experiences in March of like, what's going to happen? Well, how's this going to look like? And, you know, for then everyone to stay at home, and I'm driving down to Brewster, and it's like the roads are empty, which was nice. And going to a hospital and thinking, we have no idea what's coming around the corner, and what to expect. And then we had nothing. And it was a very ghost-like time. And literally we had days where we had no ER visits. And then we had no inpatients in the hospital, and all the surgeries were canceled. And the CEO was saying, we don't know, we have enough money to maybe for the next couple of weeks paychecks, and we don't know if we're going to even keep the doors open. So that was a very big, real situation early on in the season. And it went on for months, and luckily we got some money from the CARES Act that pulled us through. And then suddenly July came, and it kind of, I don't know, for me personally, it didn't seem like it trickled in. It seemed like it got hit by a semi-truck. It just seemed like 1 week we were fine, and then suddenly we had a lot of patients come in. Everyone hearing me so far?
Yes.
Yeah.
Very good.
I think some of the, I'm trying to know how to express this. We initially had, I don't know if everyone knows, there's a nursing home across the road called Harmony House, or Regency now, but we initially had a few residents from there that came over. So it was like, oh, you know, you're thinking, oh, this is just going to affect, you know, mostly people over 80. But then we stopped having any patients like that. And I think that the biggest shock for me was suddenly there was an influx I would say for us, probably a 19-year-old old to 52, 55 patients in that age range that were coming in that were very, very sick. And all those things that you hear that, oh, they probably have diabetes or hypertension, we were finding that all these people didn't have anything. And like, oh, there's the cat. And I was working on a couple of those you probably read in the paper about the people that died there. And I think that the biggest shock for me was when the autopsy came back, and you know, they were young people and they had no what we call comorbidities, no other illnesses. They were pretty essentially healthy working people that just turned around and dropped dead in the shower. So it's stuff like that that suddenly is like, well, that can happen to them. Could it, you know, what about the rest of us? You know, it's kind of a bit more of a mortality wake up call. And then, you know, we had little kids coming in and extreme high temperatures, and they were running around like there was nothing wrong with them. So there's all these weird, like, none of this is adding up, and how do we deal with this? Just backing up, I don't know if a lot of people knew, we had an OB department that closed down in April because Family Health Center doctors they had to join up with OMAC. So that closed down a big department in our hospital, and it actually shut our nurse ratio down. So we pretty much lost a nurse. So there's a team of 3 of us. So I'm actually a charge nurse, an ER nurse, and a floor nurse. So there's just 3 nurses on in day shift and 3 nurses on at night shift. So for our little critical access hospital to suddenly have an influx where it's like a never-ending stream of people coming into the emergency room, just felt really overwhelming. And it was getting progressively worse every week, that we felt we were getting to a breaking point where I just was pretty much on tears to my boss and saying, we got to get help here because we're drowning. And it took a couple of weeks there, but we finally got some backup. But I think it's probably about the most terrified I've ever been in my life, is just feeling like we're getting swamped and there is no help out there. Our policy was to not admit patients that were COVID positive. And the reason for that is because we don't have a pulmonologist, we don't have a respiratory therapist, that we would always ship. Usually we ship patients to Wenatchee, Central Washington Hospital. They have an ICU there, or if they were busy, we'd ship them to Spokane. But there was a couple of weeks there where we would have these very sick patients and needed to be shipped to somewhere, and everyone was full. So Wenatchee was full, so the doctor would call Spokane, they were full, and we called another hospital, they were full. And so we got to this point that no one could take these patients. So we admitted them onto the floor, which then added a lot of stress on us, because we had these patients that really shouldn't be there, but there was nowhere else for them to go. And we'd have them for a day or 2. And luckily, you know, we had a few that did recover and we could send home. But there was a few that it's a weird disease. They seem to do well, fine. You know, they're just on oxygen. But as soon as anyone needed to be on a ventilator, we don't do that at our hospital. So we had a few that they were just slowly going downhill, and luckily, the few times that happened, suddenly a bed opened up in Wenatchee, or we've actually shipped patients to Seattle to find beds for them. So I think I'm rambling, but I think the last week or so, it's finally, I feel like we're over the crest and feel like I can start to breathe again. We're still getting COVID patients, but you know, at the height of it, I would say probably 90% of our patients with COVID or COVID-like symptoms. And then of course there's the other 10 that there's always going to be heart attacks or traumas or something else going on. So that would always add into the little stress level that we had, that, okay, we got all these people really sick and now we've got a motor vehicle accident that's coming in as well. I would say now we're back to probably 40% of our patients are COVID-like symptoms, and then the rest are more of our regular patients. And when I say COVID-like symptoms, it was initially very hard to, with the whole testing situation that we had. I don't know if people realize, but after our tests were taking up to, in the end, 10 to 14 days to get results back, which is basically the quarantine period we tell patients anyhow. So it was almost to the point where, why do we even bother testing them? Because we're not going to get the results back. So it's anyone who came in with a cough, fever, you know, sore throat, diarrhea, we pretty much had to just assume they had COVID. So then it was pretty much the whole emergency room usually was rule out COVID patients. Any specific questions so far?
I'm wondering what you're thinking about for what's going to happen with flu. What was your usual flu season like before COVID?
Well, last year, I do remember we had our first flu positive in August.
Oh, wow.
So I'm really glad. So far on my shifts, I haven't had one. And you know what? I don't even know if I don't think our flu tests have even arrived. I'm not sure about that. Let's see that. So it's going to be interesting. I was hoping we were going to have a break before the flu season, because I can pretty much honestly say on behalf of my team and the other teams of nurses that we are emotionally and physically spent and burnt out. So I was hoping for a little bit of a breather before we hit that. It varies from year to year. And so we'll see. As you say, this is such a bizarre year, and everything is like, okay, one day at a time, and we'll work it flew out when it happens, because I know it should be on the radar now because it is August, but I'm really hoping it might be a later season this year.
Well, what I've been reading is that some people are thinking it won't be as bad because of social distancing and mask wearing.
Yeah.
And so there's hope in that, but they're still all recommending get your flu shot early, even like now, to give our emergency room nurses a rest. Yeah. Well, that's amazing what you've been through, Belinda. I mean, I'm getting anxious just listening to your story. That sounds horrible.
I'm very, go ahead.
Go on, I'm done.
I just wanted to say that I'm very grateful for what you shared, and very moved, and I have to say that I've been praying a lot. So there is not, I haven't just been doing tasks, but what your situation is just must be multiplied 1,000 million fold all across the country. And I can imagine so many of our medical professionals are just completely wiped out. So thank you so much for all of your efforts, and bravo, and hang in there.
Yeah, yeah, amazing.
No, I'm such an empathic person. I'm just like tearing up up here. Oh, and I just, I've been worried about Three Rivers Hospital for years and years and years. And it just comes back to me again, how important that hospital is to have there in Brewster. And so I would love to talk a little bit about, I don't know, ideas or ways to support the hospital, ways to support your team. Thoughts like that are crossing my mind right now. So
I think awareness, like I do remember before I worked at Three Rivers and then just living in this end of the valley. I mean, very fortunate because you've got Mid-Valley Hospital in Omak. So it's an hour drive from my house to Omak, and it's an hour drive to Brewster. So, and I think living here, before I kind of understood the whole, our hospital down there, it's like we're very lucky here. We have a choice. And say if the road is closed over to Omak, you can go down to Brewster. And I've heard people say, well, why are we funding so many hospitals? We've got Tonasket, we've got Mid-Valley, we've got Brewster, we've got Chelan, we've got all these small hospitals. Why are we doing that? And I think I feel that's just it's a kind of a very insular view on that. Well, this is the Methow Valley, and you do have a choice up here. But if you live further down the end of the Methow Valley, or you live up Bridgeport, or you live up on the plateau, Manson, it makes a big difference for the community around there. Is when you need critical drugs, so as you have a stroke, where time is what we call time is tissue, that we have medicine that can do magic for heart attacks and strokes. And if you take one of these little critical access hospitals away, it will affect a certain population. And unfortunately in Brewster, it will affect probably the more socially economic disadvantaged population, because they're now got to go up to Omak and increase their travel time if they needed critical medicine. So I think just making awareness that Three Rivers is important for not just this valley, but the community like Bridgeport, Brewster, Terrace, or the town of Methow, is like we are, it makes a very long drive for communities that live there.
yeah, thanks for that. And yeah, I hope that your crew does get a break and you can replenish yourself. And yeah, we didn't hear from you. I talked to you earlier, but just about how do you replenish yourself? How do you, because you have also been, I think, working overtime because of the understaffing and also just that stress of just being exposed more. How are you managing that?
I'm a pretty strong person, but you know, everyone has
You
their
are.
limits. Yeah, it's nursing period is got to have a certain thick skin, and I definitely have that British bulldog kind of attitude. But I definitely had some really low points when I felt really overwhelmed, and I felt like we were drowning, and how how I dealt with that was just going back to taking every minute at a time, and then once I got home, where I have my friend Bo, and pretty much I had to let go of my partner. You know, I knew he couldn't handle it, and so I had to pick who I was just going to offload on. And I had a very dear, sweet friend Bo, and then we pushed out, and we just went out into the mountains here. And I just, as I said, the mountain trips has been my little church and my saving grace, and just sitting up there and like deep breathing. So incredibly fortunate to live here. I'm sure we all know people who've been stuck in other countries that just have to live inside an apartment and not even allowed outside the apartment. So, you know, a good friend and this as our playground outside the window is really helped me. And I had some deliveries of a few bags of Willowbrook Farm produce that was left on my doorstep because I wasn't eating very well. And so little touches like that helped me. Luckily, you know, luckily our surge hasn't been too long, because really I do feel chronically tired, and I know that, and nursing can be like that anyhow. I usually try and take a break every couple of years. I leave it for 6 months, and my last break was 2 years ago, so I'm kind of at that. I know in myself that I need to step away at some point, but I haven't quite got there, and I do feel very loyal to the situation right now in the hospital, because I don't know if people know that we've been advertising for nurses. There's no one applying. No one's applying for these positions. We can't compete with pay. So if the few jobs are out there, probably people are going to where you can get paid more in Wenatchee or Bellingham or Seattle or wherever. So to come and work in a rural hospital, financially is a little harder. But then, you know, I offset it because I've got this right outside my doorstep, and that's worth way more than getting an extra $10 an hour.
Oh, thanks so much, Belinda, for just really giving us a clear picture of your experience. And I know it's intense. And so thank you, as Laura and Christy said. And anyone else have any questions or thoughts for Belinda? And then we'll hear from Laura.
Is either one of you working with the county on COVID testing?
I did some of the National Guard testing. But that's all.
Do you have any do you have any words about the different kinds of testing?
Well, I don't know what kind you have, Belinda, but the tests that they're using are supposed to be fairly accurate and with few false positives or false negatives. So I also heard there was someone someone was doing tests behind Ulrich's. Have you heard about that, Gloria?
Yeah, that's where I had mine done.
Oh, good. Well, I think all the tests are PCR tests that I know of, and those are accurate because they're testing for the DNA, presence of the DNA or RNA. So.
What does PCR mean, Laura?
Oh, don't ask me that.
Okay.
Polymerase, blah, blah, blah.
All right.
Come on, Belinda.
I have no idea.
Okay, never mind.
Polymerase chain reaction. How's that?
Oh.
Oh, Google it.
Pulled that one out of your hat, huh? Good cover.
What was I going to say? I think I wish that more people, well, I don't know. Did that answer your question, Gloria? Good. But I
Is
wish
either of you working with the school district on guidelines?
I wouldn't say on guidelines, but I talked to Adriana because she's the one that took my position because I was the school nurse until a year ago. And so I talked to Adriana frequently. I don't have access to all the resources that she's getting though, but they've got some hard choices, but it sounds like they are doing an amazing job. You know, we have our staff are really engaged. You know, we have one of those communities that's really engaged and opinionated and you know, we have the whole spectrum in our whole valley of people that don't want their kids wearing masks. And, you know, so it's we have everything. And that's the whole world. So we all have to figure this out how to do it. But yeah, does that answer that question, Gloria?
Mhm.
Yeah. So we did our little group, which I'll be telling you about. We have told Adriana that we would help her however she needs help. So, and there's lots of helpers in this valley too. But often our helpers are the at-risk age group because we're old and retired. So we have to be careful about that part.
Yeah.
But I just wish that people could hear, I mean, it's always for me, those firsthand accounts of what it's like in the ER or when I'd read the stories in the New York Times about what was going on. And people don't relate it to themselves, like here at Okanogan. It's always somewhere else that seems distant and disconnected from their real life. And I think people don't realize it's happening right here. It's people in our community. That's a lot of people that are infected and that have died. So makes it very real to me. So I don't know. I'm glad you're recording it. And thank you, Belinda. That was just perfect how you just sort of talked. So anything else? Any other questions?
Yeah. Laura or Kari, do you have any questions you want to toss in there? You're still on mute.
Oh, she's good, I guess.
You know, not specifically. It's interesting because we're over in Bellingham too, and so it's interesting to come to the valley, spend time there, and sort of see how. I mean, I'm so impressed how what I would call the natives, you know, the real residents, I think are taking it seriously and certainly working hard to keep the community safe. I get really worried about some of the tourist crowds who don't seem to be, and I don't know if there's more, you know, and I guess hopefully we're getting to the end of that season. But I don't know if we've seen issues arising because of that, any increased spread in the valley. It doesn't appear that way from the numbers, which I'm so thankful for. But do you have a perception about that?
Yeah, well, that big testing that we did at the barn, 375 people tested and one positive, and they were from Oroville.
Wow. Wow.
That's sort of amazing.
Yeah.
Yes.
And I know you would think, but I've been seeing people when I drive through Winthrop, I've been seeing lots of masks.
Good.
I think masks are happening. And we didn't even get a big surge after Memorial Day. When that happened, it was, remember, super busy. And I
Yeah.
thought, wow, we're going to get it, and we haven't got it. I mean, that's sort of surprising because it's so contagious on the inside and interior places. And that's back when there weren't masks at Hank's. So I thought, oh, they're going to get it. But it didn't happen. So I think in general, people are being very careful. Kari, yeah. Would you like me to talk now, Trace?
Sure. Yeah. Yeah. Just dive into your story. Can stretch.
Oh, I know. Well, mine is not near as dramatic. It's more, more trying to deal with the systems that are there and that really aren't there. So that, I don't know if you all remember, but 20 years ago, people did not, in this state of Washington, didn't want to pay registration fees. They wanted registration fees on cars lowered. And so when that happened, that's how they had funded public health. So it just got totally defunded. When I first moved here in 2001, there were still people in that building in Okanogan, and now it's sort of an empty building. It is empty building. Lori's there, Brian, it's just, they used to actually have programs and doing things that public health should do. And the things that public health should do are things that other people that don't fit into a fee for service or what is the word? It doesn't fit into an economy. No one's going to make money off of doing the things that public health does. I mean, that's why you have them do it. Who needs to track for women that have just had babies and do home visits? I mean, those are really important. And preparing for a pandemic and having plans in place and ready. And I feel like, we've been knowing this was going to happen forever because this has been happening. Is that though it has been happening, our disease is making that leap from people, or not from people, but from animals to people. And sometimes the transmission person to person didn't happen, but this one is like the perfect storm. And although we knew it was going to happen, public health is something that you don't know you need it. You think, oh, and everyone's always in a budget cut. It's the one that gets cut year after year until we have an empty building. So that in Washington state isn't the only one. It's happened all across our country. And so we're really paying for it. We're paying for it with people's lives. And it's really hard to see because we've known this was going to happen. And if anyone's interested in sort of a nerdy book, but really well written, there's one by David Quammen. He wrote it in 2012, and it's called Spillover: Animal Infections and the Next Human Pandemic. So he wrote that in 2012. And what was interesting, first of all, he's a scientist, but he's also a really good writer. He used to write in Outside Magazine a lot. And he looked at all these different outbreaks throughout the world and looked at them. He was just a good storyteller of how these bat droppings and the horses. And so this has all been happening. He looked at Ebola. There's been several Ebola outbreaks, and he's been really studied them. So it's fascinating. It's sort of dense because is really science writing, but it is fascinating. So we've known this is happening. But this was the perfect storm in that now global travel, everyone travels everywhere, which I've always worried about the Methow for that, because we have a lot of travelers. And in the past, we've had low vaccination rates, which is a perfect storm for things like measles and mumps and rubella. And so we had that. And also COVID, some aspects of it, that it has a relatively long incubation period, so that people are going around shedding virus and not knowing that they have it, or the asymptomatic, they never really got that sick, or they're just feeling a little low, and maybe it's the allergy season, or maybe what, and meanwhile they're spreading it. And it also takes a long time for people to die, so it kills the host after several weeks instead of right away, and all that time it can be spreading. So that's what I call a perfect storm of just the aspects of this disease, global travel, and very weakened in public health infrastructure. So when that happened, I was like, you know, my ears were perked up. I'm like, in January, I'm hearing about this and I'm going, holy crap, could this be it? And it just like unfolded in a slow motion horror story like we've seen. And I tried to figure out, well, I just retired last year. And I thought, okay, I've been a nurse for 40 years, working mostly in public health. I had to deal with a lot of the outbreaks at the school. And I thought, how could I help? So I started contacting Lori. And Lori Jones is the community health director of public health. She's also, so the structure of public health, you have a community health program director, and that's Lori. But Dr. McCarthy is the health officer, and he is the one with the legislative or the legal authority to actually close things down and to really make things happen. So I contacted her, and she was so overwhelmed at first because, like Belinda said, it sort of hit like a tidal wave. And I didn't get hold of her for a little bit. And then finally, you know, that's right when the cases started skyrocketing. And I got a call from Alana Maynor, who's our community activist. And she was putting together, Lori had asked her to put together a list of volunteers. And I told her I'd be willing to voluntarily coordinate these people. So I've been sort of like, the one that does the emails and gets the Zoom meetings together. And so basically there weren't any, you need some sort of protocol so that contact tracers know what to do. Like, what do you say? Then what do you do if they say this? And then what sort of a recipe. So we worked on that. They also had got a computer program, which actually they got it about a year ago, that they had used with environmental health to track their cases of things. And that's when they would do restaurant or not coronavirus, communicable disease investigations. So they've had this, it's called Health Space. So Lori wanted to use Health Space for COVID tracing, but you know, it was being developed as we were trying to learn it. And most of the people are my age, so computers, I'd say computers were a problem with getting people how to just jump in and use a program that had no user guide, no nothing. So we worked on a user guide and actually got that late in the game though. And then we basically staffed testing centers. When the National Guard said they'd be out, we went in and we staffed those, but mostly just from our community, a little bit in Okanogan and maybe in Brewster. But it's an amazing group. I thought I knew a lot of people in the Valley, but I didn't know a lot of these people. It was really retired healthcare providers and nurses and epidemiologists, and what a rich community we have, rich in experience, and rich in that they're willing to give their time. So I was involved in that way. So I talked to Lori probably 3 times a week, just trying to see what she needed and trying to help her connect with the right contact tracers who could speak Spanish or whatever, and just sort of help her out. That was sort of and then I would be her communication with our group. It started off at 25 people, and we probably ended up with more like 15 more active people. So, so I felt like I tried to help in the best way that I could. And when you're retired, the good part is, or I feel like it's good, is that you can just do, you can choose what you think you're good at and then just do that. And when you're gone, then you're gone. I'm going tomorrow to go to South Dakota. I told them, sorry guys, I'll be back, but I'll check my email. But it's just nice to be able to contribute at what I could do. And a lot of what I did at the schools and in my past work with health departments was organizing groups of people into coalitions and stuff. So, and it seemed like that was needed. So I was glad I could do that. I think looking ahead for COVID, like what's going to happen, I mean, who knows? But it looks like it's not going away quick. We're learning all about it at this point. I see what the experts are thinking for when we'll attain herd immunity. It used to be 70%. It's moving down to maybe 50%. But that might be wishful thinking. I'm not sure. I think that we have masks in our future, and social distancing is not going to go away fast. That's why I worry a little bit about winter. I mean, it's hard enough sometimes now, feeling isolated. I think it's going to be harder in the winter, and I don't have a good answer for that. I think we need to anticipate it and support each other. I think Methow at Home is going to be important in that time, because especially bad driving, and people are going to need more help. I think flu vaccine, people should talk to their doctor about flu vaccine. And then keep up to date with what's happening with COVID. I don't know if people know about the website, that Okanogan County, COVID19.org. That is really great. And Alana's group worked on that and made that happen. And so I go to that to check on new numbers. I go to that to check on the testing sites. They're looking at maybe doing some more tests this weekend in Brewster, maybe, yeah. So that's where you go to look for all the latest things on COVID, what the latest recommendations are, and the latest what's happening in Okanogan County. And then I thought, really what's important for us and for really everyone is to really keep our immune system strong. We have to think about how to do that. And I think it's sort of things that there's not a magic pill. We have to have stress reduction. We have to get good sleep. We have to eat well, and we have to get some activity as we can. And all of those things contribute to being healthy. If you can't get good sleep, then your immune system goes down. If you're too stressed to sleep, that's not good either. So all of those things. And avoiding too much sugar and alcohol, I think, are important. I didn't say no sugar, a little chocolate once in a while, but a little glass of wine once in a while too. But so those are my thoughts. I'm open to any questions.
Thanks so much, Laura. Thanks for
thank you.
jumping in on this project with your expertise, and also just being willing to come and share today. So many So many important things you bring up in that conversation. I really do hope that people are going to watch our recorded. But one thing I was curious about is, you know, you as the coordinator kind of got to see through the county and maybe understand some of the patterns and why did it hit Brewster so much?
Well, of course, when they brought in all these people, 3,500 people to do cherry picking, and then put them in close quarters, and it didn't work out good. And so I did share with Tracy and with Belinda today orders that came down from the Department of Health or the state, I almost said Oregon, Washington State Department of Health. John Weissman is the head of public health in Washington State, and he set out some orders that Gebbers needs to follow. And they say that they need to test all of their workers, their ag workers, and they can't work until they've got their results back. So getting those results back is really important. And they have hired, they've hired private people to come in and do all the testing. And so they've laid down in this order is very specific. They have to have everyone tested by September 2nd, which is really soon. And this all came down when the Governor Inslee came to visit, which I'm thinking was 8 to 10 days ago. I can't remember. Does that sound right?
Yeah, sounds about right.
Something like that. And so John Weissman must have come too, and they just decided they needed to step it up a little better because 3 people died that worked for Gebbers. So that is, that's horrible. And actually, if you look on that website I told you, if you look at one thing it's stunning to me is that 18% of all of our cases in the county, which is approaching 1,000 people, 18% of them are children 19 and younger, which is way higher than other places. So a lot of children have become infected, which I think probably speaks to people going to work from the community, working in close proximity with other people in ways that they can't social distance, and then come home to families. So that's my guess. But so what I'm hoping to do, and I have a date to talk to Lori on Monday, is to talk to her. I'd like to look at our data. Since we entered all this stuff into a computer program, maybe we can get it out and find out how many people, just find out what data is in there, like how many were asymptomatic, how many whole households got infected, everyone living together. I don't know, just be curious to find out, and maybe how many of the contacts did we actually get hold of? Because contacts aren't that easy to get hold of. They don't recognize a number on their phone. I don't answer numbers that I don't recognize, not usually. So so I'm hoping that we can do that because we have, like I said, doctors and epidemiologists on my little volunteer group. So that I hope that will happen, because as I said, with COVID not going away soon, we need to figure out what we did. You can't figure out what you need to do different till you figure out what you did. So we got to figure out what we did and then how we can do it better. And so I don't know if we'll see how that goes. I'll find out.
Wow. Well, thank you so much for all of your work, Laura. Thank you, Belinda. Does anybody else have a quick question? It's 4:59, so I just want to respect everybody's time, but any last?
Thank you very much
Oh,
for
good.
the session.
Oh, good. Yeah.
Yeah,
You can always ask us. We can always respond to questions later. If you have some ideas, I'd be glad to, Gloria.
Okay.
Yes.
Good.
Thank you very much. I deeply appreciate it.
Good, Krista.
Yeah. I learned a lot, and I know I'm so grateful that we do still have Three Rivers. I'm just so glad that that you guys were able to get some PPP funding, because if you hadn't been there,
Yeah, and we do have PPE. I think there was some rumors out there that we didn't, but we we were the one benefit of the surge hitting us late is we were well supplied. So if we had been hit like New York at that timing, we wouldn't have been so pretty, but we are covered that way, and we've had a lot of donations. So
Oh, good.
So
Good. Well, yeah. I really appreciate your time, everybody. Thanks for being here so much. I'm going to stop recording.
All right.